Well, welcome everyone to today's Lunch and Learn program, and very glad to have with us Dr. Pamela Salisbury, who's Professor Emeritus in the College of Public Health, Health Behavior and Health Promotion. She's also the Program Director for Community Engagement Programs at the CCTS, and also chaired our recent task force on diversity, equity, and inclusion in the CCTS. And in all these efforts, especially in the community engagement, that's one of the big themes there is increasing the diversity of people who participate in research studies and being inclusive in that area. So we're very glad to have Dr. Salisbury with us to lead, I think, mostly in a discussion around these issues of diversity, equity, and inclusion in research. So I'll turn it over to you, Pam.
Okay, thanks, Stuart, and thanks for asking me to chat today. And I would offer my own Happy New Year and welcome. I guess this is, I think, probably your first one since the new year started.
That's right.
Yeah. We can hope for a better and healthy new year, right? I'm gonna put up some slides here in a minute, but I want to just say at the beginning that the slides really are to help structure our discussion. I really want this to be discussion-based and to really help you reflect about the role of DEI in your own area of research, and then in your own, and how you think it may play out in your research career. So I really want you to sort of put your sort of reflective hat on. I have some resources that I'll suggest that you can look at. I think we all know there's many things that we can look at now in terms of giving us some ideas and thoughts about DEI. So I'm going to go ahead and see if my there you go. I assume you okay, so we're okay. We can see them, right, Stuart?
Yes, it's even showing the right slides. Very good.
Okay, there you are. Okay.
Never works for me the first time.
There you go. And I sort of subtitled this Charting a Course Forward, because I'd like you to think about, again, at the end of this hour, about how your own course will include DEI as part of it, or may influence what happens through your career. So again, lots of discussion base that I hope we're able to have. Because I'm new to the group, I think the group probably knows one another, but it would be helpful for me if we did do a quick round robin in terms of introductions. And maybe I'll call on Stuart to call on people rather than people having to figure out who's going to talk next. But what I'd like to know is what stage you are in your training, what your personal research interests are, and how do you think about right now DEI in relation to your work? So I'm going to go ahead. And actually, before we do that, I will answer these questions for me, so that I can begin as a, I mean, Stuart sort of gave an introduction to who I am. So I think we're always in training, right? So even somebody at my stage of career, which is an emeritus, you know, I'm still learning. I'm still involved in activities that help me push the science forward, push our diversity in workforce forward. So, you know, you could think about me being at the end of the career, but still thinking that there are things, many things that I still need to learn. My research interests actually have always been, for over 30 years, in the space of race and ethnic and income differences in health. So I've always had a very rooted interest in disparities and disparities across both economic and racial and ethnic lines. That's expanded as time's gone on. I've taken that and been interested in essentially the race, ethnic, and income subgroups along a life course projection. So how does early life exposures to things like racism and economic inequality affect one's lifetime ability to achieve health? So those are my sort of research interests. And how do you think about DEI in relation to your work? For the work that I've done and continue to do, I think it's central. And we'll, I don't want to say much more about that. So I'm going to go ahead and let Stuart call on folks. And so if you can just give us a quick run through of these, if you feel comfortable or have the ability, given where you are, to flip your camera on, that would be helpful, but that's not a requirement.
Well, Erin, would you like to start?
Yeah, sure. I'll go ahead. And I'm sorry, I do not have camera access today.
That's absolutely fine.
Or else I 100% would have it on. But so I am a dual MD PhD individual, and I'm in the PhD part of my program right now, biomedical sciences, and I am a fourth year. And my research is actually looking at how estrogen therapy in transgender women might alter cardiovascular disease risk in individuals who have HIV infection. So it's mostly immunology based, but I also have some endocrinology and virology as well as cardiovascular disease interest related to my work. And so as far as diversity and inclusion, I think my project already is looking at gender diversity. And that's something that I have a keen interest in, and I hope I can continue on in the future. Although I think that that can extend out also to different queer groups in general, not just with gender diversity.
Thank you.
Kimberly?
Hi. I apologize. I'm in the same boat as Erin without camera capacity. So apologies for that. But I'm Kim Scott. I'm a pediatric physical therapist by clinical training, and I'm preparing to defend my dissertation for my PhD in health and rehab sciences in 2 months time. So almost rounding the corner to the end here. My research interests are sort of broadly in intervention fidelity, but more specifically in how families sort of make sense of rehabilitation within the broader scope of family life. And I'm particularly studying intensive interventions that parents deliver with their children in their home environment and kind of how that looks. And so along with that, you know, access to effective rehabilitation interventions is can be somewhat limited by geography and resources. It can be a very resource heavy type of rehabilitation. And so I'm interested in trying to understand how to broaden the reach of effective interventions specifically for very young children at risk or early diagnosed with cerebral palsy.
And congratulations on your PhD.
Thank you very much.
Yeah, Kristen?
Hi, I'm Kristen Fox.
Which Kristen?
Oh, that's right. As Kristen Gumper was next on my list. Sorry.
Hi, I'm Dr. Kristen Gumper Fettis now, because I recently got married.
Congratulations.
Thank you. I am a postdoc in the Department of Internal Medicine, Division of Gastroenterology, Hepatology, and Nutrition, where I study cachexia, or the tissue wasting that goes along with pancreatic diseases, specifically pancreatic cancer.
Any comment about the DEI in your work?
So I think the DEI in my work would come to my training as potentially a PI in the future, and making sure that people feel included, and I develop a diverse and inclusive culture within the lab I'm developing, since I'm not as much involved in the patient care, and we take whatever patient samples we can get, regardless of background. So I think that's kind of where I stand right now, but I could be convinced otherwise as I learn more.
Kristen Fox.
I'm Kristen Fox. I am a postdoc over at Nationwide Children's and the Center for Biobehavioral Health. My research focuses on disease self-management, quality of life, and health behaviors among adolescents and young adults who were born with congenital heart defects. One of the ways in our lab that we think about DEI, or one of the areas of DEI that we are most concerned with, is recruitment of representative samples. That's been historically has been a struggle in all CHD research and for our lab too. And I'm writing a K-23 application right now that is focusing on an age group, 12 to 18, where these teens will transition to adult-related healthcare. And we know that there are some disparities in who is able to make that transition from pediatric to adult care based on race. So really trying to focus right now on how I can make sure that I'm recruiting a representative sample for this project.
Allison.
Hi, I'm Allison. I was a nurse practitioner for years and then went back to school for a PhD at Vanderbilt. And I'm a postdoc right now at the College of Nursing. And I study Alzheimer's and pain. And the primary subjects that were participants that we're able to recruit are typically white. It's a lot harder to recruit non-white participants, and recruitment is a huge challenge anyways, especially looking at pain and Alzheimer's. And so that's where that comes in. And now I'm adding in sleep and some other things like that. I did more of a neuroimaging, brain activation type of study for my dissertation, but I'm expanding out to add other aspects. So that should help a little bit.
Wesley.
My name is Wesley. Like Aaron, I'm a dual degree MD PhD student in my PhD phase. My research is focused on brain tumor diagnostics and specifically improvements of stratifying populations of patients using more large-scale big data approaches or clinical data mining. So like the others had mentioned, I think one big area is just representatory populations. Like working with patients here at Ohio State, there's for sure is a bias towards the race and sort of overall pictures we draw from these data. So we extensively have been working with other groups in South America, Tunisia, and other countries to try to really get a diverse data set in that regard. And the other area we sort of dabble in is sort of recognizing equity issues when it comes to implementing different types of diagnostic technologies on a more global scale, and how certain recommendations for brain tumors isn't really achievable with certain types of next generation sequencing approaches, and developing other types of frameworks through like open source coding to help patients and help other types of clinical settings where they don't have those accessibilities to actually perform the diagnostics that are currently recommended by the WHO.
Hopefully you all saw the message from Azarius, who's having audio problems, but has introduced himself via chat. Victoria.
Hi, I just got a message that my internet connection is unstable, so if I freeze. My name is Victoria, fourth year PhD student in the Speech and Hearing Science department, and I study trying to maximize recovery and outcomes for individuals with post-stroke aphasia. And I guess would echo the concerns that have already been brought up about recruiting a representative and diverse participant sample for our research. It's very challenging for us to recruit to begin with because of some very specific inclusion criteria. And so trying to recruit a representative sample makes it even more challenging, but all the more important.
Hi, everyone. My name is Ruth Aka. I am a general surgery resident, and this is my fourth year with OSU General Surgery. I went out into my professional development years 2 years ago and entered the BSG PhD program and currently serve as an F32 postdoc fellow over at Nationwide Children's and a congenital heart lab under Dr. Vidu Garg. So my research mainly focuses on congenital heart disease and identifying genetic linkers and variants that sort of lead to congenital heart disease, and specifically in my case, aneurysms. And so I think that thinking about how diversity and inclusion sort of ties into my work, I think it's sort of twofold. Both one, obviously as a clinician, thinking about making sure that the outcomes for my patients are sort of equitable. That's one area. Obviously, I still continue in clinical outcomes research with the Department of Surgery. And in many respects, we look at how different factors like race or vulnerability status, like prisoners in different groups, how it might affect their surgical outcomes. And then in my research, I think that similar to, as others have mentioned, thinking about how we can be inclusive in our recruitment and patient and involvement of different patient groups in research, and making sure that different groups are represented within the research that we're doing. And specifically for me, given that we do genetics of congenital heart disease, making sure that we have representative samples that reflect the broad spectrum of disease.
And finally, Annalise. I think you're muted.
Is that better? Can you hear me now?
Yeah, now that's better.
Okay. So yes, I'm Annalise Madison. I'm a fifth year in the clinical psychology PhD program, and I work in Dr. Q. Colt Glazer's lab at the Institute for Behavioral Medicine Research, studying the inflammatory subtype of depression. And I guess as it relates to DEI, I know my department, as probably all the departments, have been thinking and talking a lot about this, which I think is really good, especially because, so I do my clinical work over at the Ross Heart Hospital with heart failure patients. And so obviously there's a lot of diverse patients there. And the issue is that even like among clinical psychologists who are in practice, there's just not a lot of diversity on the provider side. I think the most recent statistic I saw is that only 5% can fluently speak Spanish, which is a huge problem in terms of meeting the needs of patients. And then from the research side, I mean, yeah, I think a lot of other people have identified the issue of just recruitment, making sure that we're recruiting diverse samples. That's really important also in my line of research, so.
Everyone.
That's what a great group, I have to say. And you have your significant amount, at least, diversity of interest and diversities in backgrounds in this group. So that's great. I heard a couple of things that I would say were common, and this is not this is not uncommon for researchers. When we think of DEI, we somehow jump immediately to recruitment. And I think that jumping immediately to recruitment has partially been driven by the NIH and the NIH requirements around descriptions of samples and the need to speak to who you have in your samples. So I think that's pretty common that DEI gets most immediately linked to recruitment. but I wanna make us think a little bit more broadly in this process. And first I want to tease apart, you know, we tend to talk about DEI as though DEI is one thing. And so we say, you know, we're gonna work on a DEI plan. So as Stuart said something about, I helped put together a DEI plan for the CCTS. But what does that mean? Is diversity the same thing as equity? Is equity the same thing as inclusion? So I want to just have us spend a little bit of time having you reflect on this question. And, you know, I would first ask, what do you think diversity is? So what is it? Why is it important? And how do we achieve it?
I can try.
Okay, who's that?
It's Wesley.
Okay.
So I guess how I view equity is sort of a fairness in trying to make the opportunities, accessibilities, or other factors before, whether it's a team or a patient or whatever regard, they all have the equal opportunity regardless of the backgrounds and other factors that define them and sort of rising. So I think the classical example I see is like they'll show like people of different height at like some baseball game, and they'll like say it's not about just like giving them all the same milk box so they can see over the wall to watch the game, but it's about like giving them different heights and boxes so they all have the equal opportunities to really see the game fairly. So I think it's sort of focusing on just not about giving everyone the same share of something, but actually trying to make it fair and equalized in a sense.
Right, and we've gotten, and so I would say in our introductions, equity was not at the forefront of the discussions, right? So in your thinking about your recruitment, and again, why you might want, let's go back to a diverse group, and you want to achieve equity. Why is that participant pool, why does that really become critical? Thinking about these equitable outcomes.
I'm so sorry. I'll comment on that. So I'll just, for example, some of the intervention studies that I've been a part of are, you know, interventions that are administered for hours a day, multiple days per week. And if they're clinic-based, that can really be restrictive if people don't live close to a med center, or they don't have reliable transportation, or, you know, if it's within their home, there can be some hesitancy for clinicians to come into their home, or safety concerns potentially for on the clinician side of things, if they live in certain geographical regions. And so, you know, that doesn't necessarily speak to the needs of the child. It speaks to the environment and the social parameters that are around getting that child and family equitable access to efficacious care. And so there are some sort of real dilemmas sometimes in trying to understand how to sort of resolve just access to trials for sure, but also general clinical care that we know to be effective.
Yeah, great answer. And I'd point out, first of all, the group has done a great job at recognizing broad subgroups. So the idea of sexual and gender minorities, geography, race and ethnicity, I would put age groups in there. It would be also another way to think about subgroup differences. And the importance of so having a broad subject, let's just stick with the diversity in your subject pool, the environment may influence how the interventions work, right? And if the if various diverse environments aren't included in your trials, then you may be only finding an effect with a very narrow group of individuals who have a very narrow environmental structure. So, you know, that's a big worry, because what do we want? We really want interventions that we can push out along the translational spectrum and get them out into the population. And if we don't have tests across all of these different areas, there's certainly no guarantee. And I would say history has shown us that it doesn't work, right? There is a lot of evidence that a good deal of the work that has been done in the past doesn't get pushed out well, because it doesn't work once it goes out. The other thing that I would just point out about the equity question and why it has risen to the top of these discussions is the recognition of the inequities that currently exist across both the delivery system and in outcomes. And we would only have to look at COVID outcomes to begin to think about what we have in fact, what in fact has become more prevalent in the sort of news. We've known that there's been unequal outcomes for a long time, you know, a lot around race and ethnicity, but I would say the race and ethnicity ones are because we have measurement processes that allow us to do that. So the recognition in a society like ours of the broad inequities in health and the determinants that bring about health has raised, I think, the equity to this discussion of diversity, equity, and inclusion. And I think the diversity and inclusion part of our DEI statement, in some sense, are really function in the service of equity. So I think at the end of the day, most think that having a diverse subject pool, research team, and to be as inclusive as we can will improve our equity profiles. So I think, again, diversity, equity, and inclusion are really three different things. And that's why, you know, I sort of want to make sure we have thought about that. And let's just sort of finish up this slide and think about inclusion. How do we do that? What is inclusion? What does that mean? It's different than diversity. It's different than equity.
Sure, I'll jump in and kind of give a definition of what I think about with inclusion. So I feel like inclusion is actively giving the opportunity for individuals to join a group or a process to either contribute or participate equally, or maybe share lived experiences in order to benefit from the group outcomes.
Right, right. Excellent description. And in discussions around inclusion, there is a lot of concern about, you know, what inclusion means. Is it, do we need to worry about the sort of comfort level that people will have within a group? So it may be, I do a lot with community advisory boards. And we try to have those obviously be inclusive in having lots of different, so diversity, people at the table, but learned early on that if you bring people to the table that feel as though they are intimidated by the folks around them. So you bring a community member in to a community advisory board that is, let's say, all academics with, you know, advanced degrees. What the community member will generally say is, I don't feel like I have anything to offer. I don't feel like I belong there. So, you know, again, it's also this notion that we create a culture in which not only are seats at the table available, but those seats are welcoming. So just to sort of think about, it's not just, you know, a seat, but it's a seat that, you know, the person feels as though they're included as an equal at the table. So again, just when you think about the EEI, think about them as related but different concepts. And I just want to point out before we talk about a few other things that there, and I mentioned it earlier, there's lots of resources that are available to you. And I've just mentioned a few here, and these really are mentioned because they are most pertinent, I think. I just noticed a typo there. Most pertinent to you as you're thinking about your research career, writing grants, you know, working within the NIH space. So that the last three really are about how the NIH, that should be not HIH, but NIH, how NIH is thinking about DEI, and most specifically, we haven't talked about this yet, the idea about addressing structural racism. So Francis Collin has a sort of op-ed in Cell, which came out in June of 2021. Again, you know, an important thing to think about and read. The next one is the National Institute of Minority Health and Health Disparities, its strategic plan. And it's an important document. I just want to point out, if you've not seen it, in that it makes a nice distinction between minority health and health disparities. And so there's a lot of discussion, a lot of effort going on in the equity space right now. But they really want to make sure that minority health and health disparities aren't always equated. So minority health is exactly what you would think it is. It's health of minority populations. Sometimes there may be no disparities, and sometimes there might be, but the research, the concerns are about the health of a particular minority group, however that gets defined. Health disparities really are about differences in outcomes that are traceable to factors that really have a social context, and so are really in some communities, you would say they really shouldn't be occurring. So that these are disparities. Again, they can be around. They could be in education. They could be around economic differences. A whole host, geographic differences, a whole host of ways in which health disparities manifest themselves both in the US and across the world. So again, that's a nice document to look at that distinction. And then finally is the NIH put out a Unite statement. I think now it's probably been 18 months. It was one of the first things that they put out was a statement around structural racism. But if you're not familiar with any of these, it would be a good exercise for you to go in and just take a look at these NIH documents, because they're going to be relevant to what NIH is funding. So, again, bring it back down to an investigator importance, understanding where the funding is going to go over the next 5 to 10 years. You go and look at these strategic plans and understand what they are thinking about within the context of these strategic plans. So all of these relate to the topic for today, which is our DEI topic. So I just wanted to point out lots of resources out there. These are, just 4 of probably, hundreds. The first one is a broader document, and it is around a strategic plan for the AMA. And it has to do with advancing health equity in general. So again, important documents to pay attention to, whether or not you're a clinician or whether or not you are a researcher. So just wanted to be sure that you had some idea of where you might go to look for more thoughtful pieces. You might generate more discussion, reflections about what's being written about this at this time. In our last 20 minutes or so, and we've touched on this, but I want to sort of segment or move into, let me put it that way, to think about your roles. And again, I want you to think about yourself as a researcher and think about how DEI is going to be reflected in your practice as a researcher over the next 5 to 10 years. So what are the roles that we generally play as a researcher? Well, sometimes we're a team member, sometimes we're a team leader. And I just sort of put there, you know, are they different in terms of roles? You know, this will hit at the sort of question of workforce capacity. We are often the drivers of the science. You know, we're asking questions, we are writing papers, we are writing grants, we are taking up funding that could go elsewhere. And then I would say, importantly, we are a representative to the general public of the scientific community. So you know, we as an individual may want to think about our obligations to you know, put forward particular thought processes around DEI in the space of the sort of general population. So I want you to think about these roles a little bit, and I would like to have you, and all of you in all of your work clearly have been team members, and some of you have been team leaders. I would suggest that you probably have all been team leaders in some capacity. And call out a couple strategies you've used or seen effective in developing diverse teams. Haven't seen anything?
I guess I can describe one. So our lab does some neuroimaging, and the Center for Cognitive and Behavioral Brain Imaging in the psychology department, where we do our imaging, started an initiative to increase the diversity of students that are involved in neuroimaging research. And so one of the students who was awarded the, it's sort of like an undergraduate fellowship. And she was awarded the fellowship, and then she did kind of rounds in a couple of different labs and then decided to work in our lab. And so I thought that was a nice way for them to provide opportunities to learn about the kinds of research that are being done for students who might not otherwise feel that they have the time or capacity to engage with that kind of volunteering because they're getting paid, and then also to let them choose, you know, what lab they're ultimately going to be spending their time in.
Yeah, nice example. And again, various diversity supplements are also an effective way to bring in diverse members. And you've noted, I think, what one of the barriers might be in the development of diverse teams. And that is especially when positions on teams are for students, volunteer or unpaid internships. We all, you know, have heard that problem. It becomes a real barrier for students who really are needed to work, to pay tuition, to get, you know, food, that sort of thing. So some sort of directed dollars that can help support diversity on the team is one way to do that. Is there other ways other than just money? Money helps, but. What about barriers?
Well,
go ahead.
just another kind of informal method, I guess, is, you know, when there have been students who have been interested or expressed an interest in the kinds of research that we're doing in our lab, trying to just encourage that interest. And if they have the ability to volunteer or do a undergraduate thesis or a master's thesis, you know, to work with us in our lab on our data to try and kind of, you know, promote the learning that they can receive from that experience, but also the benefits that we can get from having a more diverse team.
Right. Right. And we've talked some about those. So that there are benefits to the team when the team is more diverse. Here I want to have you think beyond, and I said this at the beginning, you're also the driver of the science, and you might not feel that right now, but you will be. You know, this is a group that is going to drive the science in the next, you know, decade or so. I want you to think about, you know, where do the questions for your research come from? So how did you decide on the topics that you're currently studying?
This may not directly answer your question, but my advisor has PCORI funding. And so it's been helpful for me to see an example of including stakeholders in developing questions, and also, you know, patient reported outcome measures from their perspective. And so I guess, you know, just having mindfulness that our questions can be derived from insights that are learned from people who are benefiting from the science, and trying to keep that in mind.
Yeah, excellent. And when we hear from, again, back to diverse group and include them in the questions definitions, the science is more likely to speak to their needs, right? So rather than just think about how do I pull in a diverse sample, how do I bring in and include in my thinking around the problem persons that have lived experience with those issues. So excellent answer. We've talked some about sort of the protocol and the methods section, so to speak, so that we, you know, I've heard a lot about recruitment, samples, and retention. I would just say, you know, we have to think, even when we get a diverse group recruited, retention incentives, while most IRBs are going to require those to be equal, they may actually not be equal if you've got a diverse group. So it may be harder. You may be putting more hardship. I think, I can't remember who it was, but said, you know, you might have a protocol which requires days in the clinic. There are only certain group of people that can afford to do that, either afford it from work off, if that's part of the issue, or having family members being off to bring that person into the clinic. So that in thinking about retaining, there is, I think there will be some interesting work over the next 3 to 5 years in the space of IRB and ethics about what you need in order to retain a diverse group, and is all incentives, is an equal incentive equal, I guess. You know, we haven't really talked about a definition of outcomes, or in terms of what metrics we look at, how do we define success? And what do we do about subgroup analyses? And so I would just throw those out as you write protocols, as you put together analyses plans. Is it enough to show an overall gain in health if that overall gain in health is at the expense of a certain subgroup? And so it is, sort of well-known in public health that you can have an overall health improvement, but you may actually worsen outcomes in subgroups. And so a part of DEI, I think in the future, especially the E part, is making sure that any of the work you do looks at outcomes along not just an outcome for the full group, but how it works in particular subgroups. And so as you think about yourself as being the driver of the science, I want you to think about how that means, the inclusion of a diverse team members in sort of the workforce. How do you include a diverse set of voices about what the questions are? And then it's going to go to the heart of your methods and your metrics and what success is going to look like for your science. And then finally, and I know we're getting close here on time, I would challenge you to think about your responsibility as a scientist and how you will be accountable for how DEI is included or not in the work that you do and the work of sort of how society views science, what is funded. And then fundamentally, we haven't talked much about this, but this idea of trust. And we have heard a lot about trust in the last 24 months with respect to vaccines and subgroups. The scientific community, I think, has the responsibility for transparency, for inclusion, and to think about how we can engender trust across groups, and importantly, how do we address those outcomes? So, in closing, I would just like you to sort of think about, where you are right now, and if you could. And I would challenge to say you probably can. Is there a strategy that you could use to improve your current environment with respect to DEI? And I'm just going to open up there and then also let you, I think my last slide is just questions. So open it up for comments, questions in the last 5 minutes. So let me ask this more directly. What do you think about what is the responsibility as a scientist in representing to society what we do and who we work with and the role of DEI? Do you think you have to articulate that? Do you think that you need to be able to speak to that to the general public?
I can speak a little. I guess to think about in a few regards. In one sense, like from a research outcomes perspective, I think it's really important to think about the conclusions and the facts you draw from your research. How is that going to be interpreted? I think especially during the pandemic, we've seen a lot of effects about certain papers going out, how it affects the public perception of things, how we end up reading and taking in information. And I think I always comment to my partner, I feel like researchers really need to do their due diligence and what is the outcome they predict of their research, because a lot of times we're really focused on the impact factor or the numbers that really help us push our career, but then we don't think about what are the outcomes by putting out this paper into the general public. And I think the other one is going to be also thinking about just how our community is built and the perceptions. Do we just want to make ourselves look like we're closed off, don't ever interact with the public, and there's this sort of perception we don't know what's going on, and there's always these rumors we're trying to push some sort of other agenda going on, and really trying to get ourselves out there and engage with the community so they don't have these types of perspectives. Because even when you think historically, science has done things that have really affected the comfort people have in engaging with the healthcare system. And, you know, just acting like it didn't happen isn't going to solve anything, because a lot of those issues are really deeply rooted already. And I think having comfort and recognizing those faults and engaging back with these communities and repairing those types of effects is really important, because it's not going to be just some blanket statement like everyone feels the same way about healthcare. And we can't just say, oh, we can just do it their way and they'll eventually get along with it. We need to sort of understand the factors from that and try to improve ourselves with those types of discoveries.
Good answer. How about anybody else? Any questions? So I think we are, I've got us at 12:58. I appreciate the opportunity to be able to chat with you all. I wish you well in your semester and in your research. I would encourage you to think about DEI as you move forward, pick pieces up, you know, read them, talk among your groups, challenge each other to think about, you know, what needs to happen to change the culture in whatever place you're working. I will wish you a good afternoon. Thank you.
Thank you, Pam.
Thank you.
I look forward to seeing you all next week. We'll have a program on a tool, not a toy, using social media to advance your research career.
Great. Take care.
Bye, everyone.